All right, 7 minutes after 11 o'clock. Thank you for tuning in. It is time for the Head to Toe Care Show with your host, Dr. Riadh Fakhoury. He is in the studio ready to answer your questions. Dr. Fakhoury is a chiropractic orthopedist and the owner of Fakhoury Medical and Chiropractic Center here in Ocala. His office is at 1009 Southwest 16th Lane, and his phone number is 352-351-3413. Right now, we invite you to call Dr. Fakhoury on the radio because we can all learn from the answers that you get about your condition, and we will pay attention as Dr. Fakhoury addresses your specific issue, and of course, you can take that and get well with that information. The phone number here is the WOCA Climate Control Source Hotline, 352-622-9622. Good morning, Doctor.
Good morning, Larry.
And that's what it's about. It's about getting well, being well, isn't it?
Information and getting well. That's right. You know, there's so much in our health. It doesn't matter what you have. If you don't have your health, if you don't feel good, it's just difficult to function.
You are distracted by whatever it is, whether it's hurting or just kind of making you blah, right?
Right. This morning I had a nice discussion with a wonderful lady. She is actually a beautician. And, you know, the poor thing, she's on her feet all the time, and she uses her hands so often, and she's getting numbness in the left arm going down to the finger, and she's getting that pain. We talked about the plantar fasciitis a couple times.
Yeah.
And she has so much pain in the bottom of her feet, it distracts her from the pleasure and the joy of working with people and the job that she does. So we talked a little bit about that, and you know, the plantar fasciitis, it can be so painful, it can last so long. However, the treatment is so simple in that getting the orthotic that we build at the Fakhoury Medical and Chiropractic Center under her feet to support those arches where they're flat.
Right.
We'll relax that big tendon in the bottom of the foot, a deep massage in there, some ultrasound, and we can get rid of that for her. And she was asking about the neck and the numbness in the arm.
Yeah.
And she's been letting it go because everybody gets so busy in life. They like to just put it off, it'll go away. But, you know, these problems usually don't. So we talked about addressing it. And she said, you know, do I need to go? We talked about different features and different things that we have available for care at the Fakhoury Medical and Chiropractic Center. We talked about the rehab and the chiropractic massage. We also talked a little bit about the interventional medicine, the epidurals, facet blocks. And she said, well, do I need an epidural? I said, no, you probably will not, because we could probably take care of it with chiropractic and rehab and massage. You know, we don't want to jump up a few rungs on the ladder. We need to start at the most simplest method, and we can take care of most of the problems there.
Right.
So we had a nice chat, and she had a much better understanding at that point, and not to just let it go, because it will get worse. And now it's a very busy time for her, so she'll notice an increase in the symptoms. So she'll now come in and get that taken care of.
And the two symptoms that you just described that she had, numbness in the fingers and also pain in her feet, are they fluctuating or are they constant? And is that important for the listeners to kind of pay attention to? Like, because I would imagine, I'm trying to put myself in her circle.
Yes.
And let's say she says, you know, it was hurting this morning, but it's okay now.
Right.
Tomorrow morning it hurts again, that kind of thing, right?
Yeah, it's sort of tricky because when you feel good, you don't want to do anything about it. When it bothers you, you want to take action, and the next day it's feeling good. Her feet bother her all the time, so they're constant. The feet are what opened up the discussion, and the arm came into it after the fact, because the arm is more intermittent, and it's on and off. So usually what strikes people to take action is something that is interfering with their lifestyle, or the pain is becoming constant, or it's becoming very severe that you can't ignore it any longer. Advil, Tylenol is not covering it up. That's when we usually see people. So it's been there for a while by that time. So the feet are getting to a point where it's affecting her on a daily basis. Every morning when she steps, she feels that pain in the bottom of the foot. Right. That's what opened the discussion. The feet are easy to take care of. The thing that concerns me is more the intermittent pain of the left arm, because it tells me something is pinching in her neck, because it's going down to a specific finger and it's going down the arm. and then before you know it, the weakness sets in. She'll start dropping the scissors or the comb.
Right, right.
And then there's damage that's occurring to the nerve because of that. So what I want to do is, the feet are easy to fix, but I want to make sure we take care of her neck so there won't be any damage to the nerve or something that will affect her later in her life.
Which is, that's the good thing about knowing you're in good hands, is that you'll take that care. You know, this morning we heard an example of the domino effect in health. We heard about a lady who had cracked ribs from an automobile accident, and because it was causing her to breathe shallow because it hurt to breathe deep, it was causing some kind of pneumonia to start.
Yes, yes. And when we are, because for 25, almost 26 years now, we've been working with trauma cases and traumatic injuries like accidents. We've seen many patients come in with rib injuries and with rib sprain strains and with rib fractures also. And usually in the emergency room, they won't put a rib belt on because they're afraid that you'll get a pneumonia or something, because they fit you and they won't follow up. You may not come back to the emergency room again.
Right.
And so, but when somebody comes to the Fakhoury Medical and Chiropractic Center, they have complaints of that sharp stabbing pain in the rib cage, taking a deep breath. We take an x-ray. Whether we see a fracture or not, sometimes we'll fit that person with a very simple elastic corset that takes probably 80-90% of the pain away. But we have to tell them at the same time not to wear this all the time, because it does limit their breathing to a certain degree. But because they're being supported where the rib is injured, they can breathe better and they can breathe more comfortably. So we watch them closely and make sure that they're not getting any type of upper respiratory problem with it, and it allows them the relief so they heal faster, they're not in pain all the time, they sleep better at night, because when you have a rib injury, the worst time is at night. You end up usually in a recliner because you can't lay in bed,
right.
You can't sleep through the night, you've got a pillow under your arm. So the rib belt will actually help that person sleep better at night. Better rest means better healing also.
And I guess the big message we took from that story is that get it taken care of, because there is a domino effect. When one thing is, like the lady with the feet pain.
Right.
If that was causing her maybe to walk differently or something, that could, I'm guessing, that could lead to something else.
It could throw the low back out. And I actually told her that when we do support her arch with these orthotics, generally she will feel better. Her energy will be better than what it was, because when you're in pain, it drains you and it weakens you, tires you out. You're focusing on things differently. But when you do something to help you get out of pain, you have more energy. You feel better. Your whole environment changes around you.
Is there something you can do for somebody who has arthritis in their fingers? Let's say they love doing something with their fingers, whether knitting or playing piano, or I'm just trying to think of an example.
Right.
Where finger dexterity is important, and when there's pain and they can't really have that same dexterity, you're no longer able to do that thing you love.
Yes.
Is there anything for them that can be done?
There are. There's stretches that we can do. We can mobilize the wrist and the fingers. We had a patient we talked to this morning that was having some carpal tunnel syndrome, which is the nerve, the median nerve right in the middle of the wrist that gets trapped and causes the first three fingers to get weak or have pain. And so we can manipulate the wrist. We can adjust and mobilize the fingers. We can give stretches. We can do therapy. We have laser therapy, ultrasound, interferential therapy that would be helpful in that area. Those are very positive things that can be done for dexterity. We also have the supplement, the glucosamine sulfate, at the office to help to lubricate the joints.
Right.
And so there's different things that we could do. Sometimes there's a deformation of the joint, and there's not much that we can do because the joint is fused. But more times than not, we could do something to give relief and increase range of motion. And whether it's the hand or the back or the neck, when we bring motion to an area that's stiff and not moving properly through the mobilization of chiropractic and the mobilization of massage and the mobilization of rehab, the body has a tremendous ability of recovering and rehabilitating and getting back to more normal function and less pain also.
I was watching this video of these boxers jumping into the boxing ring, and I was thinking, wow, there was a time, and I was never a boxer, but I mean, there was a time when I was that agile, where I could, hold on to the fence and jump over the fence.
Right.
I can't imagine doing that now. you know?
Well, you know, if it's just because the lifestyle has changed a little bit.
Yeah.
But if we worked you back in, if we did the rehab and stretched the muscles and it brought that elasticity in the muscles, there's hope. If we did certain exercises to build the strength in the legs, you know, you would be able to go back into that. But your life has changed, and your environment, the ergonomics, as we talked about, has changed also. So you don't do those, but it doesn't mean that you can't go back. We see many patients that are coming in, pain and stiffness, and let me give you a more simple example than jumping over a fence. You know, I can't stroke playing golf and hit the golf ball anymore. My back is stiff. I have lack of mobility, and my shoulders are tight, so I can't swing fully, or I have pain afterwards. So what if we took that individual and through the course of rehab, massage, chiropractic, increase the range of motion of the shoulder joints, the low back, we decrease the pain, and we brought the flexibility back into the musculatures. So decrease pain, increase flexibility, increase strength. Why not? They can go back into those activities again.
Wow. You should have a shirt that says "Health by Fakhoury," or you remember "Body by Jake"? Remember that guy?
Right. Yeah. That's right.
I mean, seriously. I mean, if you're out golfing and you couldn't golf before, and you've helped somebody get back to that point,
it's very rewarding.
We take it for granted.
That's right. That's where we're talking about. Your health can't be taken for granted. You say it very nicely, Larry, because you can't. If you lose it, you can't replace it. You can't buy it back. It's not possible. So you want to be aware of your body, and when your body is giving you symptoms of tightness, stiffness, numbness and tingling, pain, weakness, dropping things, recurring pain, those are things you want to address those before you get that cascade, or I think you call it the domino effect of problems.
Yeah. By the way, there was something I wanted to ask you about in one of the stores I was at this weekend. I don't remember which one it was. I mean, there's all these sales going on. One of the items that looks like it's probably a pretty hot item as a gift is this back massage thing that sits in your chair, and it looks like it pushes, I don't know,
almost like it needs you.
Yeah,
right.
With a K.
Right.
Not needs you like your dog does.
That's right.
But yeah. I mean, is that a good idea? Is that going to cause more harm than it helps? What is your thought on that stuff?
It's hard to say. It depends on the situation and on the problem. If somebody has a disc problem in their back and that is pushing on that vertebrae and pushing on that area of swelling, it'll aggravate them. If it's just a matter of somebody has tight muscles or fatigued muscles, then it'll be helpful. So if you use it, see how you feel after 10 minutes of using it. If you feel better and 1, 2, 3 hours afterwards, then it's good for you.
Okay.
If you find that it makes you worse 2 hours afterwards, or you feel more sore, then think back to what did I do 2 hours ago, and you use that and discontinue the use of that. So the type of problem that's causing the pain can be benefited or aggravated by something like that, because they're pretty forceful. It's pretty strong, and that's why an advantage at the Fakhoury Medical and Chiropractic Center is you have the massage therapy being done by a licensed massage therapist. It's hands-on, because sometimes you push harder, sometimes you push lighter, sometimes you work around an area where a piece of equipment can't really sense that, and it's pretty standard. You don't get those adjustments that are done by the palpation while you're working on somebody.
Now, what about those things that you put your feet in? Sometimes you put water in them. They vibrate. They got little knobs on the bottom. Do they do any good at all? They probably feel good for the moment, but do they actually do good in the long run?
In the long run, I don't think so, but I think they will help you to relax. They'll help you to feel good. They'll stimulate the bottom of your foot, the nerve endings, a little warm water with some saline in there, or Epsom salt. I don't think there's
What does that do, by the way? I mean, I can understand the warm water. What does the salt actually do?
I don't know the method of it. We'll have to go to that many generations back and look into that wives' tale. But it does work, though. It pulls. It seems to pull the toxicity or the soreness out of the muscles, and it could be possibly because when you put salt in water, it makes it more concentrated and more dense, and that may encourage some of the toxins within the cells to be pulled out of the cells and into the circulation, where they can be taken away from the body. So that's just a theory.
Yeah.
But
But you hear great testimonials about some of those things.
Yep.
I mean from people you know.
Sure. And putting your feet into warm water and some vibration is just generally very relaxing. It's probably like meditating or sleeping or taking a nap. For some people, that'll be very rejuvenating. I don't see any reason why not to do that. But if you're pushing mechanically on an area like with the rollers in the back, if you do have pain, just be aware that if it makes it worse 2 hours later, something's going on. Discontinue it and let's find out what's happening with it.
Let me mention the phone number because Dr. Fakhoury is here to answer your questions. So if you have one, go ahead and call. The number is 622-9622. That is the WOCA Climate Control Source Hotline, 352-622-9622. If you're listening on November 28th, 2012, then you're listening to a live show, and that's usually the case with Dr. Fakhoury. Very, very rarely do we have a pre-recorded show.
I'd rather look right at you and answer the questions, so it's good.
Yeah.
So we had interesting scenario of just in discussion with a patient. She was telling me that two of her friends, two sisters, were involved in an accident about 3-4 days ago. And they were actually broadsided. They were just going along their way, and somebody cut through a stop sign. And I don't know why people are in a rush, and they do that.
I know.
And broadsided. And we talked a little bit about this. I'd like to talk a little bit about the ergonomics, the mechanics of that. Our necks work forward and backwards very nicely, but side to side, if you try to take your right ear towards your right shoulder and left ear towards your left shoulder, it doesn't go very far, does it?
No.
So when you hit from the side, I worry about that. And I'm going to give this scenario and then another person's scenario also. So I'm very glad that these two young ladies are coming in for treatment because of the fact that if we don't take care of it now early on, whether it's lifting a bag and twisting and feeling immediate pain or a collision from the side, we have to address it because when you get those side forces at a high speed, your body moves very, very quickly and dramatically, and muscles get torn, injury happens, and so many patients that we see coming in later in life have problems because there was some injury, whether it's a sports injury, working in the yard injury, or car injury, that didn't get treated early on when it's the best time to take care of it. And so sharing that with you a little bit, and also another individual, it was very interesting because she was in a motor vehicle accident about 4 days ago, and I did a quick check on her because she hasn't been in the clinic yet. We were just in discussion on this, and she's going to be coming in Saturday, but in her scenario it was all on the right hand side. And so I asked her, did you get hit from the side? Because I expected that she would have gotten hit from the side because it's all one-sided. Because if you think about forward and backward collision, if you're looking straight ahead, both sides will get it equally. But in this case, the swelling and the inflammation, the spasm, and the vertebrae that are pushed out of place, because that top bone that we talked about, the atlas, was shifted, giving her a headache behind the eyeball. And so it was interesting. I wanted to know what the mechanics of the accident. I thought for sure she was broadsided. That's why it was one-sided.
Right.
But she actually said no, but she was turning around to see her daughter behind her.
Oh, okay.
And of course you know the rest of the story.
So she got hit in the front?
Yeah.
And okay, and then because of the angle her body was at, it was like getting hit from the side.
It was all one side, exactly, because her body was turned, which she shouldn't have been doing because she was distracted from the road.
Right.
But she felt like she needed to turn around and look at her daughter in the back. We just a quick second distraction like that, and getting that front impact was exactly like a side impact injury. So very important to address that, because those side impacts or injuries where the car torques or twists, or the body twists in there. If you hit in a corner, then the car usually shifts and your body twists.
Right.
Side impacts and twisting are very important injuries to take care of, because there's going to be some trauma that will present itself later on, and it's so important to get it taken care of early on, not later.
And just for redundancy's sake, mention that 2-week time frame you have now because of the law.
Yes.
You get in an accident, you got to go see a doctor. You don't have you don't have any time to waste.
Yeah. The downside to the law is it's taking your right away to try to wait and see what happens. You know, if you pay for insurance and you want to wait 3 weeks, 4 weeks, that should be your right. But the insurance is limiting it to 14 days, or you lose your benefits. So if you're in an accident, come in by the 14th day for sure. So the positive side is that it gets people in earlier and quicker for treatment, which will get a quicker resolution and a better resolution for them. Yeah. So that's the positive side. The downside is that they could lose their they will lose their benefits if they go to day 15. And you know, sometimes people don't realize that at the Fakhoury Medical and Chiropractic Center, we've been dealing with trauma for 25, 26 years, and we, you know, it's important to know how to take care of that, because trauma is a little different than other scenarios, because there's other things that could come into play. We discussed, I couldn't remember, Dr. Shanawani at one point, because he looks at the patient from a medical point of view and we look at them from a chiropractic. He got something that was very good at, I couldn't remember if it was a lacerated kidney or liver, and he told me it was a lacerated kidney that he was able to pick up on from his 25 years of experience of dealing with trauma care. And the CAT scanned and airlifted over to Shands to get that taken care of immediately. So having our team, multidisciplinary team, will allow more eyes to look at the individual to catch some things that may may slip through.
And earlier you mentioned losing your benefits if you wait till day 15, and to my mind, benefits is not the money; it's the ability to get the care you need. I mean, it translates to money from the insurance company's perspective, but that money then becomes care.
Yes.
That is the important thing to remember, is that if you wait till day 15, you might not get the care you need.
That's a very good point, and that's important, because if your benefits are not available, some people may have insurance, health insurance that has a very high deductible, or may not have insurance at all, and they may not be able to take care of themselves the way they should if the benefits are not available, because they did not react and get care within the time that's constrained. I don't think it's right, because if you're paying for insurance, you're paying for insurance, and you're paying for 100% insurance. Well, unfortunately, the insurance companies have been able to pass the law through the legislature that limits it to 2 weeks now, and also limits the coverage to 25% unless a medical physician feels that you need some additional care.
The phone number, we've got about another minute if you want to squeeze one in. If not, then you'll have to call Dr. Fakhoury at his office. The number here right now is the WOCA Climate Control Source Hotline, 622-9622. And what is the number at your office again?
The telephone number is 351-3413. 351-3413, and option 4 will take you to the front desk or our patient care coordinator, Amy, and they'll be able to assist. If you have a question, feel free to call that number and leave me your number, and I'll call you back. Or if you're having a problem, want to get evaluated, then the ladies can help you in whatever questions you have. It could be, some people have questions on insurance. Is there a deductible? Is it a copay? Are there any limitations? Are we on the plan? Are we not on the plan? If I don't have insurance, you know, what is my out-of-pocket expectations? Those are all questions that they do an amazing job at being able to answer, so that way we can help.
Dr. Fakhoury, always good to talk to you, and it goes too fast sometimes. We're talking about one thing, and next thing you know, we're done. So
it's amazing.
The bottom line is, feel good. Don't go around feeling bad.
That's true.
And if you're in an accident, get it taken care of right away.
Yep, especially with a new law coming around.
Yeah. Well, and there's so many reasons. I mean, there's people out there, I don't know, they're coming out of the woodwork. They're all over the street today. Right?
It is. It took me longer to get from point A to point B.
I know. All of a sudden, Ocala has more people. I'm not sure what happened.
It's the holiday season now.
Thank you, Doctor. We'll see you next week.
Thank you very much. Take care.
We'll take a little break, and we'll be back.
Accident, injured, hurting, pain affects so many of us and keeps us from enjoying our daily routine. This is Dr. Riadh Fakhoury, board-certified chiropractic orthopedist at the Fakhoury Medical and Chiropractic Center. Let me visit with you to answer your questions. Let us help you help yourself on the Head to Toe Care Show every Wednesday, 11 a.m. on WOCA. Again, that's Dr. Riadh Fakhoury, here to help you on the Head to Toe Care Show every Wednesday.